In Africa, there are millions of people who live out of the reach of healthcare. 1 out of 5 children will not reach the age of 5. They will die from malaria, pneumonia, conditions we know how to treat.
What can be done to contain the spread of these highly contagious diseases?
There are still people having to survive with Ebola who are still being discriminated against, who have had misinformation provided about them.
They have the vision, they have built a workforce, but the need to now expand that is something that is important in the future for them to be able to respond rapidly to in a public health emergency.
There's very little in Africa going on about how to identify these diseases, and we can help with that matter. Because the density of hospitals and availability of medical assistance is slim in countries like Africa, they don't have the kind of hospital setup like we have in the United States. What IdentifySensors does is take the bodily fluids, insert it into the container the size of a box of cards. It reads what is happening in your body. It is the diagnostic tool of the future. In preliminary testing, the results are fast, simple, and definitive. Results are sent to the user in minutes by text message or email. IdentifySensors has begun manufacturing these devices. While the Check4 platform is not yet approved for sale in the United States, IdentifySensors is pursuing multiple FDA submissions.
This technology allows patients to test themselves without access to complex hospital systems and could play a significant role in reducing infectious diseases throughout Africa and other low-resource regions.
No one has ever done this before. The way these sensors work is they can detect the RNA or DNA of a viral pathogen or bacterial pathogen.
This technology, which we fictionalized over 50 years ago on Star Trek, is the most promising technology I've ever been a part of. It's now becoming a reality.
If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus.
This will not be the last pandemic. History teaches us that outbreaks and pandemics are a fact of life.
I suppose the best thing that could come out of it is that we would realize that we are all in it together.
You understand, the sooner we can get this to market, the more lives we will save.